Well, my earliest memory of anything is the day it all happened when I was 4 years old. Just laying on the sofa and this big black mask coming over my face, and all my baby teeth were taken out on that day. When I was 15, I began to realise that my back teeth were beginning to go bad. The dentist said, well, they're not all bad, but for convenience sake, we'll just have the whole lot out. It'll be much better if the whole lot just come out in one go. So I woke up, I had no teeth, and I just feel so ashamed that this should have happened when there was no need for it to have happened. And I just feel such a loss.
After years of suffering with inadequate dentures, Jenny has decided to try something new. She has an appointment to see Dr. John Besford, who has a referral practice specialising in removable and implant prosthodontics. His first task is to find out what the problems are.
Do you feel that you have been given enough opportunity to make comments and so on about teeth as they were being made?
No, I've never had that opportunity.
If you could have one problem made better to do with your teeth, apart from having your teeth back, which would be ideal, what would you ask for as your first sort of most important sort of change or improvement?
That they would look more natural.
Okay.
I think that would be my first priority.
Right, and what don't you like about them at the moment?
The fact that they look so even and unnatural, especially when I smile. I'm the sort of person that will occasionally give a big belly laugh. I've discussed this with other dentists and they said, oh, no, you don't laugh like that. You don't pull your top lip back when you laugh. And I said, but I do. I said, I know how I laugh.
Exactly, how would they know?
Yes, but they argue with me and they've said, no, you don't laugh like that.
Inhibited laughing, I confidently look forward to several belly laughs before this is over. Any other problems?
Eating has always been a problem. I can't remember the last time I had a steak.
Really?
Something like that.
You'd
yes.
like a steak?
Something like that, yes.
Okay.
Yes.
Very good. Well, we'll make that one of the objectives, if possible.
To be able to tear it apart without.
Well, yes.
Yes.
Boyfriends must have been a problem.
Oh, yes. Things like, well, French kissing. I mean, I've just always kept my mouth to myself, as it were, in that respect.
Yeah.
Even with my husband now.
Yeah.
I mean, it's something I just can't go into.
Yeah, so this is a danger zone, a trauma area.
Yeah. And now I'm feeling, of course, with age, that my gums are shrinking even more.
Yeah.
And so I think my face must have a sort of a squashed. It feels squashed now.
Does it?
Yes.
Okay.
Yes. When I try and relax, it feels all.
Well, we can do. I'll make a note of that too. What we call occluding vertical dimension, the grandmother Giles effect.
It would be so nice to have a set of teeth that that I don't have to adapt to.
Yes.
I'd rather like the teeth to be fitted.
Very good.
For me, as opposed to having the.
That's one of the philosophies I teach. Actually, is that to minimise the need of the patient to adapt.
Yes.
So you put your finger right on it.
Jenny has agreed to treatment. Ruth Pessock, Dr. Besford's nurse, helps her choose the colour of her new teeth. Dr. Besford will add his opinion.
The first thing you need is beautiful teeth, or teeth that look very real, that have the light coming through them in such a way that they resemble natural teeth or are indistinguishable from natural teeth. The second thing is that the teeth need to be of a colour and shape appropriate to the patient, or at least chosen by the patient. Some people want very light teeth, but an awful lot of people don't. They want teeth that look real for them. And the shape of the teeth is often visible from photographs. I also choose the size of the teeth from photographs using special methods to do with measuring between the eyes and so on, but it's quite easy to do. Dentures are a matter of great shame to many people, and if they are very obviously dentures that they're wearing, I think that is something that inhibits people enormously. So I think this idea of being able to produce something that would deceive an onlooker is actually quite an important matter.
Jenny's working impressions have been taken. At her next visit, the moment has come to set up her new teeth.
We've had what's called an occlusal rim or record rim made, and that is to work out the lip support so that so your face is the right sort of shape. And that's what we're going to use, this rather strange looking object here. So the first thing to do is to find out whether this actually fits. Do you feel that it's sort of smooth? Have a little feel there. It's not. Can you feel a bump, sudden bump as it comes out?
No, I can't feel any join of the...
No.
Well, I used to be able to feel.
Yeah, this clever little instrument here, it measures how far forward the teeth are relative to a fixed point in your mouth, which we call the incisor papilla. And this is 10 millimeters horizontally forward and about 12 vertical. And if we take your current denture and put that on instead, that's about 8 millimeters forward and about 10 vertically. So this could be part of the building up of the vertical element of your face that you need. Have a look again.
Yes, that's better.
Is it?
Yes.
And I just cut away bits of wax. And this, for me, is the really exciting bit. And that's why I think that it should be done by the dentist, not by the technician. Nearly all of these cases are set up by technicians in laboratories, miles away from the patient. No face, no lips, no opinion. It's much better to do it right there, where it's going to be. And also it gives you plenty of time to think about it. I think that's something like the photo. What I'm now going to do, Jenny, is just to produce a little bit of wear on the edges of these teeth. If there's one thing that dentists could do that would make their dentures look a bit more real, it would be just to trim the edges of these front teeth. Special worn look. Don't be polite, but take your time.
And I can see how it's going to take me time to get used to the front ones being so different, but I think it's right that they should be like that, rather than just going straight across like they have done for the last 33 years. And I'm feeling very, very excited.
For all sorts of reasons, dental nurses can be a tremendous help. My nurse, the wonderful Ruth, as I call her, she is actually requested by me to take the side of the patient and to represent the patient as a kind of advocate in matters of appearance and so on. And she's very critical of what I do, so I watch Ruth's face to see how I'm doing.
The upper left lateral, I'm not very happy about the twist on it.
I look for the sharp teeth, and the angled teeth, and then the colour. And some people's teeth, I look with such envy and longing at them. And
you wish you had teeth like that?
yes, I do. Yeah.
Won't be long. I only deal with the most difficult and, in a way, damaged patients.
It's just so different.
Different good or different bad?
Oh, wonderfully different, wonderfully good.
It doesn't always take a lot of time to set up the teeth, and a number of the procedures that I use are in fact time savers rather than time spenders.
Dr. Besford's initial setup is taken to the laboratory, where the technician, Ruth Burke, places the remaining teeth.
In most cases, probably all the cases that I work with Dr. Besford on, I know the patient's name and I know some of their story. If I was working with a dentist who was not going to set those eight teeth for me, then I could cast this impression and actually take the reading and set the anterior teeth myself. So whether you get a occlusal rim from your dentist or something like this, it would bypass a whole appointment. You would need some more information. So if you work with some photographs, which we have of Jenny, that you could then set the teeth in their positions for the aesthetics, for the appearance, because you've got the incisal position from the Alma gauge reading, and you can recheck that, and then you have the freedom to twist the teeth and move them around and know that you've not increased the lip support or reduced it. I've used the Enigma teeth on cases with Dr. Besford. There's a good length on them and there's a nice shape. They're not like knife edge. On the anterior teeth, I particularly like on the lingual and on the palatal aspects that there is a nice form to them. They don't cut away like they're very, very flat. There's a good shape, and when you trim them correctly, you don't just trim the whole of that aspect off, but ridge lap them if you have to trim them to the ridge on a particularly tight case. You have a lot of that maintained, so when you're waxing up, you can get a very real feel. This patient, the one thing that has bothered her for the many years that she's worn dentures is that she's looked at other people's teeth and seen how uneven they are, and that not everybody has a nice straight row of teeth. And that's something she said herself she'd been very envious of. So I'm thinking of the aesthetics, and I'm also thinking of her personal history, her story, and how she feels about these. So I'm not going to set the lower anteriors in a nice straight little line. Dr. Besford had a preference on some of the lower anterior molds, and on this mold I've taken the two darker canines. So I have C4 for the canines and then the C3 shade for centrals and laterals. If we look at them, look down upon them, we can see that they're fairly well. They're just irregular.
Having good-looking teeth set in plausible positions, possibly with a few pleasing imperfections, is actually a very helpful thing for those people who want to keep the fact secret that they are wearing dentures. And I think that the really great denture appearances are such that they switch the observer off from thinking there's anything unusual. Or if they do think about their teeth, it would only be something like, oh, she's lucky to have such lovely real teeth.
One person who has lovely teeth is Glenn. For 10 years, she has worn dentures made by Dr. Besford.
I don't feel people are at me and thinking, you know, she's got false teeth. But it's more the things you can't see that make me feel as though I've got my own teeth again, which is very, very important. And I just wish that, you know, this had happened years and years ago.
Glenn lost her teeth when she was 22. Dr. Besford's were the first dentures that worked.
I just wish more dentists and more technicians wore dentures, because then they would understand the importance of what you can't see. It makes so much difference. It's very, very hard to put into words. It changes your whole life, in actual fact. I know it sounds a bit dramatic to say that, but it really does. It changes your social life. It changes the way you feel about yourself. So therefore the way you interact with other people. They've started to wear down. It's time for some new ones, I think. I feel confident in that I'm going to get new dentures that look like my own teeth. I'm looking forward to it.
Here we have...
Ruth has done for Glenn what she's done for Jenny. The teeth are set in wax and need to be tried in to check the final position. For the first time, she'll be given Enigma teeth.
That needs to go in a bit.
Okay, right.
Once Glenn and Dr. Besford are happy with progress, Ruth Burke makes the final denture in the laboratory.
Well, once you've got the position of the teeth, then you can just add some bulk wax to get the main shape, but not pouring wax all over the teeth or in between the teeth, just generally adding a little bit of wax. Now I'm going to just carve around and get the basic gingival margins before then I add some of the more natural contours. So once I've gone round and just exposed the crown height of each tooth, that's a very regular formation. Each one is the same, and it looks very fake, really. It does not look real. It's too perfect. So then that's when I start to use an additive technique, and this way it's easier to use gravity to help you with the molten wax and you're forming papillas. You can let the wax drops run down. While that's setting, I'm just develop this little area where we're showing the recession. We can see it clearly, and when this patient smiles, no one will really see that. But when the patient takes it out of her mouth and looks at it, she recognizes that it looks real.
Ruth finishes the gums by stippling the surface.
And I just flame one area at a time, and while the wax is still soft, I press a piece of sponge in. It has to be fairly soft. And I'm just lightly catching those margins, and it brings up that mottled orange peel effect.
Then she seals down a new wax palette and paints with wax the highlighted ridges of Glenn's own rouge.
A lot of people believe it just isn't worth taking the amount of trouble that one can do to make gums look real. And they say that's because people don't show their gums, so why go to all that difficulty and trouble? But it's not just the onlooker who appreciates the gums, it's also the wearer of the denture. And they feel more confident very often knowing that what they have looks real, even if it's not shown.
Before packing the regular acrylic, Ruth now builds in additional colour. This process reproduces the appearance of natural gums and avoids the false look of monochrome pink.
You just have to concentrate. You have to think of where you've waxed all your details and any the root eminences and any parts in depressions in the flask or the contours that you've carved, bulbous areas. You just highlight those features with the ivory pink, and then any depressions would be, you would put the dark pink on. I'm using the Enigma colour tone system. It comes with a monomer that has been formulated to enable you to place the stains, and they don't set hard in the mould. You can actually pull them out of the mould if you think you've made a mistake with the colours. So it's very important to use the monomer that comes with it. It's part of the system. You don't want is very straight lines and stripes of colours. They're not individual segments. It's layering one colour onto the other and tapping it with lightly so that it's the layering makes it look very natural. You're transitioning from one colour to another. And it had a tiny little more recession, and I'm going to accentuate that by putting some red down where I carved that. The subtlety of the Enigma colour tones is that you've got a larger range of shades, but if you want to stick with just using 3 base colours like I have just used for this natural look, then you're going to get a result that will be very subtle, and it's going to be harder to get something that looks very garish. And the one thing I'm happy about with this system is having instead of just having one shade for doing eminences, I've got 2 different shades, so I can build intensities. I can have a very subtle natural look, and I can go to the other extreme by mixing the colours. It's a greater range to fill everything in.
After processing, the denture is ready to be broken out of the flask.
And as you can see, and you've just got the skin of the sodium alginate.
Once it's cleaned, Glenn's denture will be finished.
I hadn't realised what my own teeth had felt like until John tried these in for the first time. And I just felt round them, and it brought back a memory of sort of 20 odd years ago when I had my own teeth, because although the other teeth were wonderful, they just didn't feel like these, in as much as they actually feel from the inside as though I've got my own teeth again. It's just, I don't know, something about the shape of them, just the way they feel on your tongue. It's amazing.
Jenny, too, is remembering. For her, it's the first try-in of her full waxed-up denture. Her husband has come with her. His second opinion is a vital part of the process.
Oh, what a transformation.
Oh, they must be.
Yeah. I'm wondering how come you've got your real teeth back. You know,
Ah.
it's a sort of near miracle. Yeah.
Was there anything that you noticed about Jenny's teeth that you're not happy with, or anything that strikes you at all?
Well, initially the colour tone was so different that it was a bit of a surprise, and I thought, oh, do I really like these teeth? But I'm warming to it already, so it must be quite a special job, I think.
Yeah. What about the shape?
The shape.
The
Well,
teeth.
yeah, the shape. You see, it doesn't look. There's a natural shape there. The others are truly false.
It's making me feel inside something. I don't know. It's triggering something off inside of me of feelings 33 years ago, and it's bringing back memories of the time just before I went to have all my teeth out, and just thinking, this isn't fair. This just isn't fair. And then the next time I looked in the mirror, and they weren't there. And now suddenly I'm looking, and they're all there. It's just something I never ever thought I'd ever see again. And I'm just so pleased. I'm so grateful. So very, very grateful. They're great, aren't they?
further information on these products or for a training film on the laboratory techniques shown, please contact Shotlander.